Fat-soluble vitamins. Introduction. Vitamins are substances that are vital to maintain life, and it can be classified as water-soluble vitamins and fat-soluble vitamins. Under water-soluble vitamins comes vitamin B complex and vitamin C. Under fat-soluble vitamins, vitamin A, vitamin D, vitamin E, and vitamin K. Fat-soluble vitamins are soluble in fats or fat solvents, organic substances that do not contain any nitrogen. They are stable to heat, stored in the body, absorbed in the intestine in presence of bile. Fat-soluble vitamins, vitamin A, D, E, and K. Coming to the first vitamin, vitamin A. Synonym is retinol. Chemistry, its active form is seen in animal tissues. Provitamin beta-carotene, which is seen in plant tissues, especially in carrots and all. Three different compounds with vitamin A activity are retinol, retinal, and retinoic acid. Dietary sources 80% from diet. Animal sources are milk, butter, cheese, egg yolk, liver, fish liver oil. Plant sources are carrot, papaya, mango, pumpkin. Physiologic role of vitamin A. It maintains vision, maintenance of normal epithelium and skin, and it has got an antioxidant property. Requirement: adolescents, adult males and females 520 microgram to 800 to 1000 microgram of RE. Pregnancy, increase uptake by 200 microgram, and in lactating women increase the uptake by 400 microgram. Clinical applications of vitamin A. It has got antioxidant properties which reduces the risk of cancer and also heart disease. Used in treatment of oral precancer and immunologically mediated diseases. And in leukoplakia, white non-scrapable lesions like leukoplakia, precancerous lesions, you can give vitamin A. Its deficiency, vitamin A deficiency can manifest in the eye. Manifestations in the eye is bite-out spot. Then another condition is keratomalacia. So night blindness or nyctalopia, that is difficulty of vision in dim light. Xerophthalmia or dryness of eye. Bite-out spots, which is grayish-white triangular plaque adherent to conjunctiva. Keratomalacia, which is corneal ulceration and degeneration seen on the eye. Preventable blindness is the most common cause of blindness in Indian children. Skin and mucous membrane disease, vitamin deficiency can cause rough skin. Keratinizing metaplasia in trachea, bronchi, kidney, pelvis, conjunctiva, cornea, and salivary gland. Dental considerations required for formation of amyloblast, odontoblast, maintenance of integrity of tissues, growth of both soft tissue and bone, and in severe deficiency of vitamin A, it can form severe enamel hypoplasia, defective dentin formation of developing teeth. Hypervitaminosis A is a condition due to excessive intake of vitamin A. Symptoms are anorexia, irritability, headache, drowsiness, vomiting, enlargement of liver, bone abnormalities, joint pain, peeling of skin, etc. Next vitamin is vitamin D. Synonyms are cholecalciferol, 1,25-dihydroxycholecalciferol or calcitrol, anti-rachitic vitamin, sunshine vitamin, etc. Chemistry, vitamin D2 ergocalciferol, which is seen in plants, and vitamin D3, cholecalciferol, seen in animals. It's absorbed in the intestine, small intestine, and stored in liver. Sources of vitamin D synthesized in skin on UV light exposure. Other sources are cod liver oil, salmon, fishes like salmon, tuna, then milk, egg yolk, butter, etc. Physiological role of vitamin D: it maintains normal blood level of calcium and phosphate, helps in the normal mineralization of bone, helps in the nerve conduction, helps in the muscle contraction, and also helps in general cellular functions in all cells of the body. Recommended dietary allowance of vitamin D: infancy to puberty 10 microgram per 400 international units, young adulthood 7.5 micrograms, after 25 years 5 micrograms, pregnancy and lactation increase the uptake by 5 micrograms. Deficiency symptoms: vitamin D deficiency can manifest as rickets in children and osteomalacia in adults. Types: vitamin D deficient rickets, vitamin D resistant rickets, and renal rickets. Vitamin D deficient rickets which are seen in children. Clinical features: there will be delayed development, muscle hypotonia, craniotapes, that is non-calcified areas in skull bone, swelling of rib at costochondral junction or rachitic rosary appearance, bowed legs or knock knees. Laboratory findings are plasma level of calcitriol is decreased, alkaline phosphatase activity is also decreased. Oral manifestations: there will be developmental anomalies of enamel and dentin, delayed eruption of teeth, higher caries index of affected teeth. Osteomalacia or adult rickets affects only flat bones or diaphysis of long bones, which is seen in post-menopausal women with low calcium intake. Clinical features: there will be bone pain, pathologic fractures, muscle weakness, and waddling gait. Oral manifestations: in 50% cases there will be severe periodontitis. Radiographic findings: severe asymmetric deformities in stress-bearing areas of bone, longitudinal hairline fracture of long bones. Treatment: dietary supply of vitamin D. Vitamin D resistant rickets, which is familial hypophosphatemia, refractory rickets, or phosphate diabetes. These are the synonyms of vitamin D resistant rickets, which is a X-linked dominant defect in the renal phosphate metabolism, which is characterized by hypophosphatemia and hyperphosphaturia. It is an inherited disorder. Rickets or osteomalacia which is not responding to usual doses of vitamin D. There will be normocalcemia with high normal parathormone level, diminishes the calcium and phosphate absorption, decreased growth with short stature, normal vitamin D metabolism, absence of other related abnormalities. Clinical features: in children, first recognized when the child began to walk. X-ray reveals skull deformities, retarded eruption of teeth, deformities of leg, short stature. And in adults, more serious disturbances occur: bowing of legs, shortening of stature, osteomalacia, pseudofractures, etc. Oral manifestations: there will be wide root canals and pulp chambers, connection between pulp chamber and occlusal surface of tooth, periapical involvement of grossly normal appearing tooth, development of multiple gingival fistulas, poorly defined or absent lamina dura, abnormal alveolar bone pattern. Renal rickets or renal osteodystrophy, which is chronic renal disease, painful crippling disease of the bone due to inability of the deceased kidneys to synthesize 1-alpha hydroxylase and convert 25-hydroxycholecalciferol to active form of vitamin D due to impaired calcium absorption. Treatment is dihydrotachysterol, vitamin D analog, renal transplantation. Next vitamin is vitamin E. Synonyms are tocopherol, which means tocos means childbirth and ferol means to bear. Another synonym is anti-sterility vitamin. Then vitamin in search of disease. Sources are vegetable oils, wheat germ oil, cottonseed oil, pea oil, corn oil and sunflower oil, meat, milk, butter and egg. Absorbed along with fat in upper parts of the small intestine. Physiological role of vitamin E, maintenance of membrane structure and integrity of cell, prevent the peroxidation of PUFA, then preserves the germinal epithelium of gonads, prevention of cancer and heart diseases by preventing the oxidation of LDL. Normal plasma level is less than 1 milligram per dl. Requirement: males 10 milligram of alpha tocopherol, females 8 milligram alpha tocopherol, and in infants 3 milligram alpha tocopherol. Clinical applications: combined treatment with vitamin E, beta carotene and retinol showed significant decrease in oral leukoplakia. Deficiency symptoms: minor neurological symptoms, sterility, atrophic and degenerative changes of enamel organ. Next vitamin is vitamin K. Synonym is coagulation vitamin. Chemistry: vitamin K1, K2 and K3 are there. Vitamin K1 is phylloquinone, which is seen in vegetables and animal sources. Vitamin K2 is minaquinone, which is seen in the bacterial flora. Vitamin K3 is menadione, which is chemically synthesized provitamin, which is water soluble and converted to vitamin K by liver. Dietary sources are green leafy vegetables, butter, liver, milk, vegetable oil. Physiological role involves in both intrinsic and extrinsic pathway of coagulation, prothrombin synthesis, vitamin K dependent clotting factors like clotting factor 2, 7, 9 and 10. Requirement is minimum is about 1 to 2 microgram per kilogram. Deficiency of vitamin K. So primary vitamin K deficiency, which is rare in humans, in newborns susceptible due to poor placental lipid transmission. Secondary vitamin K deficiency occur in adult with impaired fat absorption associated with obstructive jaundice, sprue, ulcerative colitis, surgical bowel resection. Oral manifestations: there will be gingival bleeding, petechiae, ecchymosis. Bleeding on brushing occur when the prothrombin level falls less than 35% and the prothrombin level less than 20%. Spontaneous gingival bleeding occurs. Diagnosis: increased prothrombin time will be there and reduced clotting factor. And the treatment is with 10 milligram of parenteral dose of vitamin K. Thank you.